The following is an exclusive presentation of Optimum Local. It's Optimum or it's not.
Hi, I'm Pat Halpin. Welcome to Optimum Locals, Meet the Leaders. We're getting you to the heart of local government right here, right now, with Suffolk County Legislator Steve Stern of the 16th Legislative District. Legislator Stern, it's great to have you back on Meet the Leaders.
Great to be with you, Pat. Thanks for having me.
So the 16th District, you cover part of Babylon and Huntington.
That's right. It's a diverse legislative district, starting in the north with parts of Huntington along 25A, down through Greenlawn, Elwood, East Northport, Dix Hills, Deer Park, and down into even parts of North Babylon at Sunrise Highway.
Now the lines are being redrawn as we speak, and you're going to be voting on new maps, new legislative districts. How much does your district change?
I think it changes quite a bit, actually, as proposed. The core middle of the district would remain the same, but some of the parts in the north, some of the parts in the south would be eliminated. And like
so what are you picking
most
up?
Of what's going on throughout Long Island, the population
Right.
is shifting east.
Right.
And so this legislative district, this new legislative district, would reflect that change with more of an eastward shift into parts of Islip.
So is it a 20% difference, 50% change? How much of a change is it?
It's a good question. It's probably in between that. I wouldn't say that it's more than a 50%, but it could be a substantial change in the north and the south, shifting over to the east. I'll tell you why I like it.
Why?
I like it because it would pick up parts in the town of Islip that center on a part of the region that we've been talking about for years together, which is the Sagda Coast corridor.
That whole corridor, Pilgrim State Hospital, all that area that's slated for major redevelopment.
That's right, and so it would be an exciting time to have the opportunity to represent the population there in full, in a more regional way than really just the haphazard way that it's been in the past. I've had the privilege of representing residents in the town of Huntington and the town of Babylon that happens to live just on one side of the line. This would give me an opportunity, if I have the privilege of representing that area going forward, really more of a regional role. And I think that's been part of the problem, particularly when it comes to large-scale development, is that everything's been handled in a haphazard way with arbitrary town lines. I am excited about the opportunity to have maybe more of a formal role in what's going to go on as plans for that particular area go forward.
Because the county's going to have to play a big role in that, especially as you're talking about a community that could have 10,000 new people living in it, that big Pilgrim former state mental hospital grounds. That's not going to happen all at once, but it will happen over time. So there are infrastructure improvements, roads, sewers, as well as other regional implications that you'll play an active role in if you're representing that district.
That's right. Yes,
so you got to get reelected in that district the next that year after next.
Correct, and we'll work hard at it. But I look forward to that opportunity.
Okay, let's talk about what's going on in the county. And you can't pick up the paper without reading something about the county's budget situation. And for our viewers, I just want to give people kind of the lay of the land and see if you agree with it. The county executives, Balone, who's only been there 6 months, when he first came in, was faced with a budget that everybody admitted had a structural deficit. Originally there were going to be 400 or 500 people laid off, and the legislature said, look, we're going to continue funding these positions for just half a year as we kind of figure out, what's the right reduction in workforce. And he did this commission that said, look, the county's finances are structurally imbalanced, and if you look at the projected spending over the next 3 years, if nothing is done, you could have a deficit in excess of $500 million. Is that an accurate assessment of this year's budget and what you're looking at over the next couple of years?
I think it is, and I think most of us agree on the principle, most of us agree on the numbers. I would just add one caveat.
Sure.
That $500 million challenge that we have in the next couple of years could actually increase substantially.
How's that?
Because so much of what we do, so much of what we are required to do, and a great deal of the funding comes from the state and federal government.
Right.
So you always, when you're budgeting, and you know this very well, when you're going forward, you always have to take that into account. And we have seen that in the past few years, where at the very last moment, federal and state dollars will diminish. So not only do we have that big challenge, and I think we all recognize that, it could be even bigger, and we have to take that into account as well.
Oh, I know exactly what you're talking about. I'll never forget I'm county executive. We have a very hard budget during the last recession 20-something years ago. And it finally got approved by the legislature. A lot of wrangling, give and take, but it was a budget. It was balanced. The state legislature comes in because they have a budget problem. Excuse me while my producer yells at me because I didn't shut off my phone. I apologize. Anyway, my producer wasn't calling me either. But that said, the state legislature comes in and takes $20 million in state aid that we were supposed to get to pay for the preschool handicap program. And before January 1st, in the middle of December, this budget that was balanced so tightly had a $20 million hole.
That's right.
So I know exactly what you're talking about.
It's a moving target, and it becomes very frustrating when you're doing all of the right things, and then ultimately you get the call from Albany, and you've just lost an additional $20 million. Extremely difficult to make that up in a meaningful way without having a real impact on services going forward. And so that's been a challenge over the past few years that will continue to be a challenge. And so when you ask the question, do we agree on the size and the scope of the challenge? I think we do, but we have to keep that in mind as well.
All right, so that said, you have to take very deliberate steps. So let's talk about what's been accomplished and what's yet to be done for this current budget.
Well, for this current budget, we continue to go through the process of analyzing the layoffs. We have restored about 100 positions, and we're very proud of that because we took a look at the layoff list and realized, I think doing it methodically and in a reasonable way, that because we had federal funding for some positions, because we had some state funding for some positions, we were able to restore and make sure that we can maintain essential services. So that's a process that we continue. But going forward...
Why is it so hard to do layoffs in government? I mean, look, layoffs are hard under any circumstance. Sure. But it seems like it's particularly difficult in government.
It is particularly difficult because notwithstanding the emotional aspect of it, which we all certainly appreciate, when you're dealing with civil service rules and the bump and retreat procedure, you're no longer looking at particular people, you're no longer looking at particular positions, because if you eliminate a person, they might be able to bump and retreat, and for every one decision that you make, there are 10 others that have to be taken.
So if they've been promoted over the years to different positions, they have rights, if that position is eliminated, to go back to their last position, which then has a ripple effect for everybody else.
It is a ripple effect and maybe even a tidal wave effect. And one relatively straightforward decision that you thought was reasonably made will have 10 other aspects to it, and that's why it's so difficult.
Okay. But that has been approved and it's happening.
It is happening. Now, there are some of my colleagues that are looking backwards rather than looking forwards. We're very proud of the fact that we've been able to start the process on implementing the county executive's deficit reduction phase 1.
And so that's part of it. What's the other part of it? What was in that first phase that is being implemented as we speak?
Well, we have a new traffic violations bureau that will bring revenue to the county.
Now, Nassau's had that for years.
Yes, they've had it for years. We haven't. We've lost an awful lot of revenue over the years. This is something that finally we were able to get together and have Albany approved.
So does that mean what? All the tickets that are written here, who gets the revenue without a traffic violations bureau, and who will get it when you have a Suffolk County?
It used to go upstate, and now we'll
go
share
to
a much
Albany.
larger. That's right. That's right. We write the tickets and we send the revenue upstate, and that will now no longer be the case.
So you have any idea how much money that might generate?
I mean, it could be a few $1 million, and although it certainly doesn't get us out of the place that we're in right now, it's one aspect. And look, there is no one big one shot. We are out of one shots, and I think that's important because number one, it's just no longer possible to govern and provide essential services utilizing one shots. But also, just as importantly, Wall Street, the bond rating agencies, they no longer want to see one-shot revenues.
And one-shot revenues means that the cash is there, but after you spend it,
it's gone.
It's gone. Okay, we have to take a short break. When we come back, we'll have more with Steve Stearns, so stay with us.
I am Sammy, and I have high cholesterol.
Specifically, Sammy and I have familial hypercholesterolemia, or FH, an inherited genetic disease that causes high cholesterol, often starting in childhood. FH affects more than 600,000 Americans, but often goes undiagnosed, leading to premature heart attack and death. If caught early, FH is treatable. Do you know if high cholesterol runs in your family? See your doctor and get screened. For more information, visit www.learnyourlipids.com.
We live in the age of mobile devices. They keep us in touch and informed. They help us work and play. And they all use rechargeable batteries. But these batteries aren't just rechargeable, they're recyclable. And more than 50,000 free drop-off locations across North America make it easy and convenient. We all enjoy the freedom that mobile technology gives us. Let's accept the responsibility to pass that freedom on. Find out how you can answer the call to recycle. Visit calltorecycle.org.
Welcome back to MTL. Continuing our discussion with Suffolk County Legislator Steve Sturt. I'm happy to talk to you about this budget, and maybe we're going a little bit too fast for folks that might be watching. But I want to give people kind of a primer, if you will, on the county's budget. Now, the reason why the county's in this position, and it's a little bit different than Nassau, but I think it affects both of them, is that this has been a deep, long recession. And the county's revenues come from the state, federal government, but also primarily from sales tax. You really don't collect that much in property taxes, except for the police.
That's right. It's actually shocking to most people when they realize that out of a $2.5 billion budget, only about $50 million of it comes from general property tax revenue.
Yeah, well, all you have to do is look at your property tax bill when you get it from the tax receiver, and you look down there and you say, gee, the county tax is very small, very, very small. To the average homeowner,
in our general
it's less than $100
area in the legislative districts, about $100.
Yeah.
That's right.
For the year.
For the whole year.
For the whole year.
Yep.
All right. So knowing that sales tax is economically affected, so people aren't buying homes, they're not refurbishing their homes, they're concerned about losing their jobs and not spending like they used to. What has that done to the county sales tax collections?
It really has had a tremendously devastating impact. From 2008 to 2009, at the time of our real off the edge of a cliff downturn, the county sales tax revenue declined over $100 million. That's really a devastating impact, because you can take a look at all the challenges that we have now going forward, and just that revenue would make such a tremendous difference in allowing us to keep services operating to their full potential. Now, that doesn't mean that we shouldn't be making changes along the way and becoming more efficient. Every level of government needs to do that. Every household needs to do that. But clearly you can take a look at the decline in sales tax revenue and see what a major source of the challenge is.
So you $100 million less in that 2-year period, but you also had a big increase in pension costs. That's the bill you get from the state comptroller's office that says, for all the people that have worked for Suffolk County, here's what you owe this year for the state pension system.
And I think that's a very important number. In 2010, we were asked to contribute by New York State towards our pension costs about $95 million.
Now remember, county has about 12,000 employees. It's down now, but also retirees. So you're contributing for your retirees, for the current employees, and they project for future as well.
That's right. And then in 2013, the projected requirement is going to be $215 million.
Wow. So
you think about that, from $95 million to $215 million in just a couple of year span. With our decline in sales tax revenue of $100 million, you can start to see where the deficit comes from.
Okay. So given that situation, can you just simply cut your way out of this? In other words, just lay off hundreds of more employees, and that'll balance the budget?
Unfortunately not, because you're still going to have so many of these legacy costs that are going to continue to rise. Our Medicaid reimbursement rate continues to go down. All of the costs of doing business continues to go up, and we want to maintain our essential services at the same time. So you cannot just tax your way out of it, but you cannot just cut your way out of it either. It really has to be done in a very balanced way.
All right. So County Executive Ballone proposed an initial package that will say, do this, that'll generate, what, $160 million?
About $160 million
in savings and revenue.
That's right. And so that's the Phase 1 mitigation plan, and that was passed by the legislature. And I think it was important to pass that initiative, number one, because it got us off to a good start in eating away at this $530 million number, but it also sent an important message. It sent an important message to our residents, to our investors, to Wall Street, that Suffolk County is serious, unlike maybe other levels of government, certainly unlike our neighbors to the west, that we're ready, willing, and able to make some of the very difficult decisions to make sure that we're on the right track.
But there are more tough choices along the way.
There are very difficult choices, and we're having some of those conversations where you never thought you'd be having. Some of the very essential services that we thought were so fundamental to Suffolk County are now very much on the table. I'll give you an important example, the John J. Foley Nursing Home, and we've had this conversation for many years now, but times change, climate certainly has changed. There would be substantial upfront revenue for a sale to the nursing home and then significant recurring savings along the way. Many of my colleagues have been reluctant to support a sale in all of these years, but now you have the conversation. The numbers speak for themselves. That's just one example of one of those important decisions that we're going to have to make much sooner rather than later.
Now, the county did something very interesting a couple of months ago where they basically said one of the county's health clinics, we're not going to operate this anymore. We're going to have somebody else operate it.
And I think that's an important new model that we're going to have to move towards. True public-private partnerships where essential services continue to be maintained. We take responsibility for that, and we continue to serve as advocates to make sure that those essential services are maintained, like healthcare.
How are they able to provide the service and not get the county financial support? I mean, in the past, the county had kind of a hybrid system. Health clinics that were built and the county was responsible for, but they were operated by local hospitals, Brookhaven, Good Samaritan Hospital, Huntington Hospital, other hospitals, Southside and Bayshore. And then there were also clinics that were operated by the county with county employees.
And you really started to see the difference in those two models. And you take some of our healthcare centers that were run and operated solely by the county, and then you take a facility like the Dolan Center in Greenlawn, which is a true partnership with the county and Huntington Hospital, run much more efficiently, outstanding service, self-sustainable for now and for the long term. That's a model that we really need to be moving towards. And so as a pilot project, as you point out, we utilized an option through the federal government, the Federally Qualified Health Center model, where we were able to bring in a private operator that will be able to run our health care services at a particular location. They'll be able to do it much more efficiently, much more cost effectively
and provide more service, longer
and provide
hours,
even more service. That's right.
So is that something that is a result of the changes in federal health care law? Some people call it Obamacare, other people call it part of the Affordable Health Care Act.
Sure, it is one of the changes, and I think at the county level of government, you're really going to see a great benefit from that. And we can debate, federal health care policy all day long, but that I think is a specific example where having federal involvement and providing localities the incentive to essentially get out of the business and turn it over to the private sector is going to be a lot more efficient.
So, you're confident that model can ensure that that people who need health care, women with children, pregnant women who need prenatal care, can get that health care, because if they don't get it there, they're going to end up going into an emergency room at a much greater cost to all of us.
That's right. That's right. And that was really a big part of the focus. That was the big question that was being asked when the federal government went through that process. Right. So I am confident. That's not going to be without bumps along the way for all of us. But I think it's going to be a much more efficient model. And I think it's important that we do it truly in a public-private partnership, because I think local government certainly continues to have a role to play in an advocacy standpoint to make sure that those services are provided.
Okay, we're going to take a short break, meet the leaders. We'll be back in just a minute.
Green, green, green. It's your home, it's your dream. Testing, keep it healthy and clean. Make it green, green, green.
Making it green starts from the ground up, so make sure the air in your home is healthy for your family to breathe. Test your home for the presence of radon. Go to epa.gov/radon.
Make it green, green, green.
I knew what I was signing up for. I knew the consequences. I got medically discharged in 2001.
Two veterans, one helping the other. He works for Paralyzed Veterans of America.
Our training is to better the veteran.
First thing he had asked me before he even asked my name was I being taken care of as a veteran?
Changing lives, building futures. Paralyzed Veterans of America.
Some goodbyes are worth fighting for. Help the Marine Corps Scholarship Foundation honor Marines by educating their children at mcsf.org.
Legislator Stern, we've been talking about the county's budget, how you're working through it. It's depressing. Nobody wants to be in a position where you're spending all your time trying to figure out how to jettison what a lot of people feel are essential services, but you have to do it because unlike Washington, you got to balance your books. You can't print money. Is there a way out of this? How do we get this economy growing again so that revenues are coming back into the counties, the towns, the school districts?
That's really the challenge, but ultimately that is the answer, getting our local economy moving. And that means thinking about big, bold projects, real game-changing projects that put an awful lot of people back to work with good-paying jobs as well. And so economic development is priority number one in Suffolk County. County Executive Malone has said that. He's made some moves in the Economic Development Department that he should be pretty proud of. And we're looking for some great things, both from the administration and from the legislature, how we get our economy moving again. Big, bold projects. Infrastructure improvement really is the key to our future.
So do you have some ideas on how to create a more robust revenue stream, ideas on how you can, jumpstart? I mean, Suffolk County's always had a capital program where you do your roads, you do your bridges, you build buildings, you add facilities at the community college, which is another economic development engine. But is that enough?
We can always do more, and we need to do more. And if we look at the things that we want to accomplish, big ideas, protecting our environment, keeping our children home, keeping our seniors here on Long Island, economic development and growing jobs, good-paying jobs on Long Island, ultimately we can't do any of it unless you have the sewer infrastructure to serve it. That's always been one of the biggest challenges.
Unlike Nassau County, which is virtually all sewered, so only a small percentage of Suffolk County has sewers.
About 30%, and that should be unacceptable to all of us because it is a great inhibitor.
What are the implications of that? Newsday the other day had a story about $21 million being approved by the legislature to bring sewers to Ronkonkoma, right in that Ronkonkoma hub by MacArthur Airport and the Ronkonkoma train station.
Yep, perfect location for a transportation hub, a transportation-oriented community and all of the economic growth that comes from it, but ultimately it's limited by the infrastructure that can serve it. And so we were all very proud just the other day to support this $21 million initiative, the county share, that it's going to take to develop a newer sewer district in that area to be able to support the big growth that we need.
But that's $21 million, but that will leverage a lot of private sector investment.
And that was really the key, and we had to show our public commitment to make sure that private developers would be able to raise the revenue that they needed to be able to go forward with the project.
What are some of the other areas from your perspective that need to be focused on?
Well, I have the privilege of representing parts of Babylon, which, as you know, lies within the Southwest Sewer District, which for Babylon and Huntington has been such a tremendous part, really the reason why we've been able to grow the economic financial corridor, Route 110 and others down in Babylon.
You're 100% right. I remember early on when I was county executive, the big property owners and businesses located on Route 110 in the Melville area, that kind of downtown of Suffolk County, came to us and said, we need to hook into the Southwest Sewer District. Right. And they paid for running the pipe up there. That's how important it was. And it was an expensive project. But that was an early lesson that, you know what, even that area, which has grown and become more robust and brought tens of thousands of jobs, needed infrastructure improvements, and that you, frankly, you don't see unless you're at your position or the position I used to have.
That's right. Most people aren't thinking in those terms, but it's so critically important. In many cases, it's really the threshold issue in being able to develop going forward. And so whether it's commercial areas, whether it's local residents in the town of Babylon that are now outside of the finished part of the Southwest Sewer District, they need to be sewered as well from a consumer standpoint.
Babylon is bringing the pipe up to Wyandanch. They have big plans for redeveloping the. Was never particularly robust, but if anything, it had really been neglected. But it was for the want of basic infrastructure.
That's right. And so we're very excited about that project going forward. We think it's going to be an important model, not just for Wyandanch and the surrounding area, but how we go through infrastructure development in the future. The problem, of course, is we all recognize the need. The problem is funding. Where are we going to get the $2 billion that it might take to be able to sewer the 70% of Suffolk County that remains unsewered? That's the big challenge. That's why I was pleased that my colleagues joined me in supporting my legislation that begins the process of creating a Suffolk County-wide infrastructure bank so that we can leverage our limited public dollars with the capital markets and private investment funds to raise the rest of the monies that we would need going forward to get the infrastructure, particularly the sewer infrastructure that we need.
So how would that infrastructure bank be funded? How would it work?
Well, let's take an example. You can say there's a $60 million project, and Suffolk County might have $20 million that we can put towards it, but we don't have the whole 60. And then maybe we go out to the capital markets, and there are hedge funds and private pension funds that are willing to make that kind of reasonable investment. What I think is the most exciting part of it is not only is it a way to raise monies that we need, but if you go to the private pension funds who represent their workers who right now are looking for jobs, it's a way not only to grow their pension account, but to put their members back to work.
So it's really a way of creating a hybrid fund so that it all just doesn't fall on current taxpayers for a future investment. You're getting other investors to be part of this joint venture.
That's right, and unlike what our neighbors to the west in Nassau County are trying to do with their sewer system, and that is simply to turn it over to a private operator, I think that there is an important role for Suffolk County government to continue to play, particularly as advocates for our ratepayers. So I think we need to continue to have that hand in it. This would be a true public-private partnership. I think a real model, not just for local levels of government, but I think for the nation as a whole.
All right, we've got to wrap, but I have to ask you a question. Are you feeling optimistic about Suffolk's future?
I am. I know we have challenges worldwide. I know we have challenges nationally. But in Suffolk County, we're making the tough decisions. We're doing it in a reasonable, methodical way. I think our residents will have a lot to be proud of in their Suffolk County government. An awful lot of challenges along the way, and you can't turn on the TV without hearing it. But I think locally, when I'm going door to door and I ask everybody in my community how things are going locally, they say pretty good.
Okay. Steve Stern, thanks so much for being here with us. And that's going to do it for our edition of this show. I'm Pat Halpin, once again helping you meet your leaders. We'll see you next time.
America had just gone to war when Felipe Adams volunteered.
I knew what I was signing up for. I knew the consequences. I took a bullet to the side and left me paralyzed.
For Armando de la Rosa, the Navy was a chance to serve and see the world.
I got medically discharged in 2001.
Armando and Felipe were brought together by a unique organization that serves our paralyzed veterans.
If there was no PVA, it'd be a lot of confusion. Our training is to better the veteran. We help out with the auto grant, the special housing adaptation grant, education, prosthetics. Our main focus is spinal cord injury and disease, but we see anybody.
First thing he had asked me before he even asked my name was I being taken care of as a veteran? And I thought that was pretty good.
Changing lives, building futures. That's Paralyzed Veterans